Hey there, and welcome back to Kidney Cancer Unfiltered. I'm your host, Anna Maria Scaccia, and today we're talking about bedside manner, why it's about more than just delivering news, and how it shapes your care. Dr. Matthew Campbell is with us today, and he's breaking down why bedside manner is all about the actions doctors take, how they explain treatment options, listen to your concerns, and build trust with you through real two-way conversations. He also shares how his mentors shaped his approach to patient care at MD Anderson, where they focus on shared decision-making and honest, compassionate communication, no matter the news. Plus, we'll dive into the importance of a holistic care, treating both the body and mind and encouraging patients to seek psychological support as part of their treatment. If you ever wondered how a doctor's approach affects your care, or why being a part of the conversation matters, this episode is for you. Tune in to hear Dr. Campbell's take on what good patient care really looks like. Thank you, Dr. Campbell, for joining us today. For our audience and our listeners who don't happen to know you, can you introduce yourself quickly?
Sure. My name is Matt Campbell. I am a genitourinary medical oncologist at MD Anderson Cancer Center in Houston, Texas. Have been very focused and passionate about kidney cancer ever since my time in training at MD Anderson. I'm an associate professor. My biggest research interest right now is in kidney cancer, bone metastases, and rare tumor research. And I'm very excited to have a chance to join you today and discuss patient care and a lot of the importance around doctor-patient relationship and other topics. So it really is an honor to have a chance to join today.
Well, thank you for joining. We're honored to have you. And yes, patient care is incredibly important. So I appreciate your willingness to talk about this topic because as a kidney cancer survivor myself and an advocate, I often hear from other survivors, whether they've been a survivor for a few years or a new survivor, that sometimes they have really great doctors and other times they don't. And I just love just to start with why is bedside manners, why are bedside manners so important when it comes to patient care and cancer care?
Well, I think you have to have a relationship that is built on trust and respect and a shared vision in terms of what the goals of treatment are. And I think if you are building that relationship with patients, over time, I think your chances of achieving, best possible outcomes are going to be much higher than if you have one-way conversations, if, the communication lines between patients and doctors are not clear. There's not an understanding of how to manage and what to look out for if you get started on a new medication. Why are we doing certain procedures? What is the purpose of everything we're doing, and what are we really looking at in the long term? I think the chances of making major mistakes along the way are enhanced. I think patients are going to feel less empowered. I think the chances of a fractured relationship and health and your in the healthcare setting is going to increase, and I think patients will likely do worse. And this is really hard to quantify. And I think in many respects, it's very hard to study, but I think that this is the truth behind a lot of our interactions with patients.
I would agree. And I think so. We say bedside manners, and some people may think, just how news is delivered. But I think in your answer, you kind of laid it out that bedside manners go way beyond just how you're delivering news or talking. It's the actual actions that you also take as a doctor. And I think you touched on treatment options. I know that is, for lack of a better word, one complaint I've heard from many survivors is that, the doctors that they went to or have gone to would just automatically go to, okay, we have to do surgery and that's it, and don't really go through options. Can you just take me through what is behind, I guess, a doctor's motivation? Maybe you don't know this, maybe you do, but what what can be behind that motivation to like kind of just want to get into the talk about like treatment, getting it done, and moving forward versus more empowering the patient with empowering the patient with different options or ideas, or just kind of taking them through it more compassionately, if you will.
Yeah, well, I think doctors, it's the same as any line, I think, of work in general, where you're going to have huge differences in personalities and skill sets among doctors. And I think some doctors feel, personality types, some are very introverted, some are very extroverted. Some people feel very comfortable in speaking with patients, and others feel less so. And I think also like level of confidence in what is most appropriate for the patient in front of you is going
Mm,
to also vary doctor to doctor. And I mean, the truth is, like, if you look in the community setting with urology or with medical oncology, kidney cancer is a relatively smaller portion of what most are doing. And so their level of comfort of going through various options may be less as compared to being seen by somebody that sees kidney cancer every day and is very passionate about how patients with kidney cancer do and are involved with the kidney cancer community in a major way. So I do think that there are a lot of factors that go into it. But I think, on our end, if you're less comfortable and have less understanding of what various options are and the ramifications of making those decisions, you may not be bringing up potential options that exist.
that's a really great point, and it makes me think that as patients, as survivors, we could probably do a better job of looking at our care through our doctor's eyes, not to necessarily, say that we shouldn't advocate for ourselves, as much as it's like when we're advocating for ourselves, also trying to understand the context the doctor is working in. So this way you can come with solutions, your own solutions that may fit what they know, and you really collaborate together. And this is leading me to a question, I promise. But um, in that way, how can patients advocate for themselves?
Yeah, I think if they don't, have a clear understanding of the direction of what is being recommended to them, I think having the ability to say, is it reasonable for me to have a second opinion, and not feeling bad about getting a second opinion is quite important. Um, I went through my own personal scare with a very early melanoma on my cheek, and it was a terrifying experience in my own life going through this. And I met with several doctors, and the honest truth was, I met with a Mohs surgeon initially, and I didn't like what they had to say. They were very direct, somewhat arrogant, and did not provide any options. And the options that were presented included, risk of loss of function or even loss of my eye, which I didn't think was acceptable at that time. And I wanted to meet with others, and wasn't really recommended or pushed or any advice of who else to see. And so I got to kind of experience that firsthand, where I felt very uncomfortable with the recommendation. I had enough sense and enough uh, ability to be already in residency and connected with the medical community to know that seeking a second opinion was important. But I think there's sometimes fear that if you end up having a second opinion, you're going to offend the doctor that you're seeing, and that somehow are beyond questioning, and that's just not true. And I encourage my own patients, if they're uncomfortable with what we're recommending at MD Anderson, I'm more than happy to connect them with other great providers and centers across the country to discuss their case, discuss their care, and see if they may have an alternative plan that's a better fit for them.
You actually brought up a few points I want to touch on. One, thank you for sharing that story with us. And I'm sorry you had to go through it. And I think that's one thing, though, that doctors don't tend to have is that personal experience to cancer. And so I know, or something that like a precancerous lesion and having that scare. And I know in my own experience, my kidney cancer, like that care was amazing. But with my thyroid cancer, my surgeon was less than pleasant. I was very much a, you don't know what you're talking about. I am the doctor, you know, you can deal with this. We're gonna go do surgery and that's it. And it was very, as you described, very like direct and arrogant. Not to say that doctors need to have this experience, but what would help doctors become more empathetic in that way, right? More compassionate in that way, where they, while we might need to put ourselves in their shoes, that they can put themselves in our shoes without having to actually experience cancer. Because a person, so it's a pretty long question for you, but I'm just thinking about the state that a cancer survivor could be in, and they're not thinking straight. All of us are not thinking straight.
Yeah, I mean, I think the medical training is moving toward a lot more experience in medical school. We have, you know, I'm getting more dated in my medical school, but the interaction with standardized patients and the feedback, I think, is very important. Having modules and having the opportunity to learn how to have more kind of serious conversations and the implications in these conversations, and have it be videoed and having feedback of how those conversations go. And I think it's also just having, outstanding mentors to learn from and see how they approach patients. I was very fortunate to have some tremendous, mentors during my time at Indiana, during my medical school and residency. And I got to watch people like, Dr. Larry Einhorn, how he interacted with patients in his bedside manner. The same with like Doctors George Sledge and Larry Kripe and just some people that are just legends in my mind, and how they interacted with patients, delivered tough news, came up with plans, and the bonds that they forged with their patients. And then I got to see the same thing when I came down to MD Anderson and worked with Dr. Nazar Tanier in his clinic, and Chris Logothetis in his clinic, and some of my heroes from at MD Anderson, and watch how they bonded with their patients. And there's a lot of tricks that I wouldn't say tricks, but a lot of useful tools that I learned, during this experience. And at MD Anderson, we had an entire program dedicated to having these difficult conversations, and we're videoed and we're given feedback. And I think all of these kind of build toward a comfort level of how to have very open, honest, two-way dialogue, how to have shared decision making, and how to deliver good news, bad news, and everything in between. And I think that that's a critical part of being involved in oncology.
That's such an excellent point. And I will say you jumped ahead, because I was going to ask you about your role models. And I love that you named all these people in your life who've helped you on your journey and kind of giving you a blueprint of what, wonderful patient interaction looks like. From that, like, what are some scenarios that we've talked about, maybe a not so great one, but what are some examples that you can share of what good, great, excellent bedside manner looks like? Like, what would that interaction, how would that play out?
Yeah. And so I think it's all about creating a comfortable environment for patients. And to me, it's having an environment where you are introducing yourself, you're listening to patients, you're trying to establish some degree of rapport in terms of understanding what is the background that led them in today, not just the cancer story, but who they are, who they're visiting with, and trying to understand, where they are in their life, and, what are they doing for a job? What are they, what are their family dynamics? Trying to understand some of these aspects. And then I think, it's when you're getting into the discussion with patients, having it in a way that is very uh, low in terms of advanced medical terminology. So having all the information provided in very patient, lay-friendly language.
Mm.
And then I think, to me, what I've really learned is that, I give all the credit to my mom, who is a retired school teacher. And she taught me long ago that the more senses that you engage, the more likely that patients are going to retain. And so I draw for every patient that comes into
Mm.
my clinic. I typically use the exam paper on the table. I have friends that also use whiteboards to do this, but as we're discussing, I'm drawing out, our discussion, whether it's taking some notes, whether it's drawing how different medications work, whether I'm mapping out different choices that we have in terms of pros and cons. And I've seen this done in a variety of ways, but I think hearing it, I think drawing it, I think giving space to ask questions, but then also having the understanding of how patients would like to follow up next after they have a chance to absorb the information, whether
Yeah.
that's a telephone call in a few days, whether that's my chart type of communication if you're on Epic, or other types of communication. And then it's following up with the many questions that often come with that initial interaction, or when you're at kind of like a major branch point in care, because I always just think it's critical that patients know that most decisions they can sleep on. And,
Yeah.
there are some decisions that have to be made emergently, but most of the time it's okay to sleep on it, give it some real thought, and then come back with additional questions, so that when we make a major decision, that they're comfortable with that decision, their family's comfortable with it, and we're all happy in terms of that plan as best as possible.
And communication really is key. And I love the fact that you brought up the style, right? Like we often think communication just as the verbally, right? As things that you say, but it's not just what you're saying, but it's like how you're saying it, where you're saying the mechanism. So that is a great point that I think we all and all of us can think more about. I do want to say though, often we don't have just our doctor, right? Like we actually have a healthcare team. So how does this extend to the team? Because sometimes you have different experiences with your PCP than you would your surgeon, than you would with your urologist, and so on and so forth. So how, as a team, can we make sure this bedside manner is still excellent?
Yeah, I think it's important to, I view my team, and my team is one. I have a nurse, May, that has been with me now for basically 10 years. I have a PA, UA, who is started with me in the last year and a half. And I have kind of now a rotating group of schedulers. And then I have, so our team continually expands. We have wonderful PharmDs that work with us, and we have a wonderful, huge team of APPs. I think the critical thing is me personally to make sure that the team members, I'm explaining to patients what each one is doing and their role. And if I'm having fellows or residents join me in clinic explaining what their role is, where they are kind of in their learning trajectory, and also seeking feedback. And I really like to ask patients, what is working well, what is not working well, and not just, rely on reviews that are put in, but really try to figure out, and if things are not working well, whether there's issues with our scheduling, whether there's issues with an interaction with a nurse or with an APP or with myself. Like, I would rather have that feedback and try to understand how we can implement improvement than not know. And so I think that dialogue is really important.
And that brings me to my next question. So we mentioned that earlier, or rather I mentioned earlier, patients' responsibility in terms of maintaining this communication, this collaboration, this kind of relationship, if you will. You've listed some examples, a lot of great examples of how doctors can be more empathetic and compassionate. What can patients do, in addition to advocating for themselves? What can patients do, or what should they do to make sure that their interactions with their doctors are make have them walk away feeling good?
I think the honest truth is that there's a lot of kind of guard up potential on both sides.
Yeah.
I think patients often going in to talk about kidney cancer are going to be anxious. They're going to be very focused. They may have some questions that they've written out, but often they may not. Um, and I think, doctors often have their guard up too, because it is not easy caring for patients with cancer. There's a lot of emotions that go into it. And if patients don't do well, it can be very hard on, everybody involved, the patient family and the provider team. So there's a lot of walls at times that can go up. To me, I think the ways to break the walls down are for, having an understanding of who the patient and their families are as human beings. What are their hobbies? What are they passionate about? What are their interests? And that makes them go from a patient to an individual, and often, go into like having a true, like, holistic, rounded relationship with their doctor team. There's many patients today that I will end up taking care of, even with metastatic kidney cancer, for well over 5 years. The number of interactions that I have with them, like on an annual basis, depending on what type of treatment they're getting, can be anywhere from 4 to 12 and beyond. So I get to know everything about these people, their hopes, their dreams, their what is going on in their life. Are they looking forward to that wedding? Are they have a major trip planned? Are there bucket list things that they're doing? Are they having struggles in their work? Are they having challenges with their insurance? What are and so as you get to really know people over time, that relationship, and I share, details about my personal life as well. They end up knowing that, I have children, and that, I'm passionate about, Indiana sports, and the fact that Indiana's in the college football playoff, like, for the first time ever this year. And we have a trip planned, and these are this back and forth relationship that we have. And this also builds, I think, the trust, because they know that I'm a human being as well, and I have all of these, like, passions and interests, and I care deeply for them, and I want to have as good of success as possible in their aspirations and care. But that's the kind of the two-way that opens up, I think, those doors to be able to have these really tough conversations at times about what is the best next step, and where we are in their cancer journey.
I think it makes it humanizing on both sides, right? Because you're getting to know each other in that way. And you did bring up families, which I think is something that we can talk about too, because the bedside manners extend to them as well. I mean, for example, with me, with when I was going through thyroid cancer, that was harder for me. And there was because of my interactions with my surgeon, I knew that I wasn't in this, like, very safe place to advocate for myself. And so I leaned a lot on my partner to be like, I might need you to be the one to interact. I might need you to be the one to ask the questions, because I know that I am not in that headspace. So just as that example, going off of that, what are some ways in which the families or caregivers can get involved to break down those walls? Because in case, the patient themselves might not be in a space too.
Yeah, that's a great question. I think, one of the things that I didn't mention that goes alongside that is, I think it's important if a patient is coming alone, I think it's crucial that they're offered the chance to call a family member, to record the conversation, to have another pair of eyes and ears ideally be involved in the conversation, because there's often a lot of information that is passed along. And I think the more that are involved in the conversation, often the better. I to me, I think when you have like empowering caregivers, I think it's really for the caregivers to describe to the patient, you have this question. I think this would be a good time to potentially bring it up. And sometimes patients will say, no, I don't want to talk about that now. But having the kind of the push to say, like, these were some important topics, or bring up and just say, look, my wife is an avid cyclist, or my wife is an avid golfer, or she's an avid uh, reader in book club, or she's involved in a lot of like she is needed at her work to be able to accomplish this or do this, and just bringing up the important surrounding things that are really crucial to know about. If you're running into different types of side effects for a different therapy, how might that impact their job? How may that impact their hobbies, their personal life? And how can we, again, kind of mold the treatment plan and trajectory to take all of that into account?
Now, I want to be cognizant of the fact that doctors don't always have a lot of time for a visit. I know people, you could be in and out in 15 minutes. So there's always that crunch, right? To just go in and out or whatever it may be. So even with that's kind of schedule in mind, where like the visit can't be long, you can't really necessarily have in-depth conversations. What are some, I guess, tips or tricks to still humanize the interaction, to still be able to build that trust without the patient feeling like they're being rushed out?
Yeah, I mean, I like to have everybody in the room have a chance to sit. Uh, that includes when I have trainees with me, because I think sometimes we have trainees standing and hovering, or family members, if there's not
Yeah,
enough chairs, standing and hovering. And I think it just like it makes everybody feel that everything is more rushed, because nobody
yeah.
wants somebody to feel uncomfortable. So that, I give all the credit for kind of influencing me on that to Larry Kripe up at Indiana, because he really took that seriously and wanted to make sure that every interaction was kind of seated. And I think that that's critical in the hospital as well, which is often a harder environment to find someplace necessarily to sit next to patients, but that is, I think, critical. And then I think it's the understanding that you have an opportunity to touch base again. And so it's establishing best ways of contact, so that if not, and it's empowering patients that I want you to go home. I want you to write your questions out. I want you to understand that I have additional time to answer additional questions that may emerge. And the idea that this is going to be a relationship over time, as compared to necessarily just a 15 to 30-minute experience. And so,
Yeah.
I give my patients that come down for a second opinion, and even if they're not intending necessarily to ever come back to Houston, I share my personal cell phone with patients. I give my
Hmm.
personal email to patients in addition to my chart, with the understanding that um, I'm going to be available to answer additional questions if they emerge. And so it's very rare. I have had occasions where that has not gone as well as I would anticipate, but that's actually relatively rare. I mean,
Yeah.
I can really count less than 10 times in 10 years where that has not been something that has turned out well, and it's gone the other way.
Yeah, I will say with the sitting part, that is very true. I like to call myself a chronic stander. I just prefer to stand. I have a standing desk. I just like standing around. And that tends to unfortunately make people uncomfortable, and they can't get past the fact that it's like, no, I just like standing. So I think I need to keep that in mind more, than maybe in serious situations I need to actually sit my butt down. Um, but I love that you give out your personal information so you could be more accessible. Do you think that the fear of being maybe harassed by patients, although that's a strong term, but where those interactions might not go so well, um, also plays a role in how doctors interact?
I do, and I think it's, and I think again, it's potentially easier for me as, as a male as compared at times to
Yeah.
my female colleagues who may have a different interaction and potentially a higher chance of harassment or other interactions to occur. I I don't know. I've talked to a lot of different people uh, about this, and all different. Everyone has kind of different thresholds for what they feel comfortable or not comfortable with, and I think everybody has to have their own personal boundaries, and I respect that. And I think, I don't have a problem with telling a patient or family if it is becoming too much that we really need to back this off. This
Yeah.
wasn't my intention, and to do my best to set boundaries that I view as are important. But I again, I've been incredibly, uh, I think it's very heartwarming that most patients treat that with immense amount of respect, and we'll still use, our normal kind of lines of communication for scheduling and other things.
Yeah.
But they know how to get a hold of me if they absolutely need me. And I provide, what to do after hours, how to get a hold of our team. I try to think through all of the things that, may occur that require immediate communication and what to do in those cases to make sure that people aren't felt alone and desperate, and we have a plan to address things as they emerge.
And speaking of, delivering bad news, one component I think of care that is not talked about often, and I know there's starting to be a bigger conversation about it, is the mental health aspect. So could you talk more about how bedside manners really play in to the mental health of the patient, not just, going through the physical health?
I think it's critically important because, the goal should be to provide holistic care, and that includes the physical care in terms of what are we dealing with the patient's cancer. But we know that going through cancer at all stages causes a severe challenge on
Mhm.
mental health too, and I don't think that there's any question about that. And some adjust very well during the process, and others have a lot of lingering internal stress and concern. And some patients are prone to develop severe anxiety, depression, even PTSD, going through this. And I think recognizing these symptoms and encouraging patients to work with um, psychologists, psychiatrists, encourage patients to be willing to consider counseling is really important. And, I personally share that I've gone through my own journeys with anxiety, depression,
Mhm.
imposter syndrome, et cetera, in my own life and career, and that I have really benefited myself from going through counseling and other uh, during my own journey. And I think that this is at times can open up the conversation for the patients that I have, that this is something that can be considered. A lot of family members are very grateful when this is brought
Yeah.
up. And, if patients at the end of the day are willing to consider, I do my best to help get them started on their journey. And if they're not, then it can be discussed in the future. But the goal is trying to help patients holistically, their physical health, but also their mental health as part of this journey.
Yeah, and I think even acknowledging it can do so much for a patient because, depending on your stage, depending on your life, depending on your culture, you may have this like internal struggle about even admitting that you're having an issue with depression or anxiety, right? Like you may not feel comfortable saying that you do, or you're not, or you may think that you're not supposed to, but having your doctor be like, okay, I'm noticing these things and I want to make sure you're okay. And like I've dealt with it too. And what can we do to get you on to get you help? It can open up a lot of doors and it could really build that trust. So I'm grateful on behalf of survivors everywhere. I'm grateful that that is something that you keep in mind because I don't know, knowing the statistics out there of how many survivors actually do get mental health care for cancer related depression. We need more of that. We really truly do.
Yeah, and we're so focused. Like it is so easy when patients come in with good scans
Yeah.
to rejoice and say, this is a wonderful day. Scans look good. We'll see you back in 3 months, 6 months, a year, whatever it is. Or, this is time to start heading towards survivorship. This is a great day. But visiting in on where we are mental health wise, how that's impacting work, how that's affecting family life, their social life, all of these things is, I think, one of the important touch points for patients that you're following in the long term over their journey.
Yeah, absolutely. Because we know that cancer does not leave you alone, even if it's not growing in your body. Just the fear of it, just the scan anxiety, it's there and it's ever present, no matter if you're 1 year into survivorship, 10 years, 2 months. So yeah, it's a topic that does need to come up more. So overall, what I'm hearing is trust, communication, and boundaries are just really important, I think, in everything in life. But when it comes to ensuring bedside manners and making sure your patient feels comfortable, you really need those three things established.
Yeah, and then I think you need a shared vision. Like you have to understand like what is the goal? Is the goal to cure? Is that what we're going for? And what does that require? Is the goal, life prolongation? And what
Yeah.
does that look like? And what is, I give a common speech to patients where my camera's messed up, but I'm always talking about quantity of life and quality of life.
Yeah.
And if I can hit both, then I'm doing everybody, all of us are going to be extremely happy. So if I can improve both of those domains, great. If I can improve quantity of life, but I'm really hurting quality of life, we have to have a big conversation about what we're doing. If I'm doing something that is harming both of these, then I have done no favors, and that's absolutely not what we're looking for. And so I think really understanding with every single move that we make, what is our intention behind it? What is the likelihood of success? If it is experimental, why we think that this clinical trial is a really good fit? What do we know so far about this study? And then, where are we in terms of the disease trajectory? And I think having these very open and honest dialogues throughout the course of care so that there's not a major surprise at a different time point is critical.
Yeah, and that goes back to what you had mentioned in terms of like it being hard for doctors to care for cancer survivors, and that it's also very emotional for them. And that shared vision, I think we also have to keep in mind, both sides, that it's actually a shared journey. We may be, as the survivors, it may be our cancer experience, but the journey you're going through is actually shared. And in many ways, you're going to be a team for some people for the long haul. For some people, it might be within their first year of survivorship. One thing I didn't bring up is artificial intelligence. We know that many businesses, many industries are integrating AI into their operations, and we're also seeing it in healthcare, right? How do you think that is going to impact the bedside manner topic, or how doctors interact with their patients?
It's a really interesting question and topic. And, we're starting to see emergence. Every conference we go to seems to have a big topic on AI and how it's impacting, either research or how it's impacting potential fields of medicine. I think that it's going to have a huge role in the next few years in terms of transforming a lot of healthcare delivery. The interesting thing was they even put out recently a study where it showed that AI was as compassionate at delivering information potentially as a human.
Hmm.
And I don't know how much that's going to translate to oncology because again, our goal is building these relationships that are long lasting, tremendous amount of continuity, and patients really have to trust us. And so I think having AI as part of suggestions along the way and potentially help us with interpreting complex molecular findings, for instance, or having us interpret complex imaging and pathology may be extraordinarily useful, but helping patients decide on what's the best on balance for them, AI may have some input there, but I still think hearing this from a human is going to be important for most patients.
Absolutely. Now, in my day job in communications, we often talk a lot about AI, and there's that continuing conversation of like the human versus AI, and really, I think this applies to oncology, applies to healthcare too. It's less about, is AI going to replace humans, or can AI do what humans do, as much as what you touched on is AI working with humans working and collaborating with AI. Because unless we achieve artificial general intelligence, and I know this isn't the podcast for it, but unless we achieve AGI, there's no way that AI can really truly replace that human element, that human compassion. So I appreciate you bringing that up and really underscoring that we can't rely on AI for everything, especially when it comes to, delivering bad news or making sure a person is comfortable or that they feel comfortable. So now you've given us so much to think about and so many insights. Before I let you go, before we wrap up, is there anything else that you would like to add that maybe we didn't touch on?
No, I thank you for doing this, and I think continually, being involved in advocacy groups and trying to kind of push this information to patients and caregivers and people in the community is hugely valuable. And so I really thank you for putting on this program, and thank you for the invitation. I love speaking about patient care. It's my passion, and it's been really an honor to share this hour with you.
Thank you. I want to say thank you for being a role model. Like, I know you mentioned your own role models, but just hearing how you interact with your patients and how passionate you are about patient care, the fact that you are going to be a role model, that you already are, I could imagine, for other doctors on how to treat patients and how to make them feel comfortable and how to make this in many ways just easier. Thank you for that. I think you need to get the applause for that, honestly.
Well, I appreciate that's extremely kind, and it really is. If at the end of the day my legacy is that I provided excellent patient care and I was able to train physicians to help in that mission, I will be very happy and satisfied. And so I appreciate again the chance to spend this time and continue doing your advocacy. You're making a huge difference, and again, really appreciate this program.
Same. Thank you so much.
Thanks for listening to Kidney Cancer Unfiltered. If you found this episode helpful, be sure to like, share, and subscribe wherever you listen to your favorite podcast. For more resources and episodes, visit kidneycancer.org or follow Kidney Cancer Association on social media. Until next time, take care, and remember, you're not alone.